I'd like to welcome Dr. Tila Kansagra to Fever Radio. Dr. Tila Kansagra has a diploma in dermatology with distinction, board certified in lifestyle medicine, certificate in plant-based nutrition, and has been working as a general practitioner, a GP, for the past 10 years, and went into general practice because of enjoying the holistic nature of the job and wanted to be able to have continuity with patients. Having had experience of not only working in GP surgeries, but in out-of-hours settings and community care of elderly services, Tila's journey into lifestyle medicine and plant-based nutrition started when she was looking at ways to improve her health 6 years ago after having her second child. Welcome to Fever Radio, Tila. I hope you're doing very well.
Hi. Thank you, I am.
So just to ask you, Tila, you're a traditionally trained physician. What led you to retrain or add training of lifestyle medicine into the mix?
So it's a long story, and I think we've all got complicated journeys. And I got into medical school when I was 17 years old. My dad was quite proud. I got the letter from UCL, and I kind of stumbled into medicine because everybody else was doing it, not that I really wanted to do it. And I think everything happens for a reason. So a few months after that, my dad actually passed away in his sleep with a heart attack. And obviously he was really proud of me. And at that moment, I thought, I want to be a cardiologist because I want to prevent something like that happening. And then about a year later, just when I started medical school, my grandfather, who was like a father figure to me as well, died of rectal cancer. And at that point, I had no idea or inclination of how, it sounds silly now, how lifestyle affects these chronic conditions, really. And I went through years of traditional training. I've been a doctor for about 15 years. And as a GP, you get patients ask you, so what do I do about diet? I especially remember two patients who were quite fit in terms of exercising a lot and had Fitbits, which showed that they had arrhythmia, found to have heart disease. And they asked me, I thought I'm doing everything right. I'm eating lean protein. I'm exercising. Why has this happened to me? And I couldn't give them an answer. And at that time, like I mentioned, I had my second child and I was going through a few health problems, nothing, major in terms of a diagnosis, but I didn't really, I had all these investigations, nothing was found. No one had a conversation with me about my lifestyle. I was given some antidepressants over the phone when I said that, my mood was affected. And I kind of lost weight in a conventional way, which made me slightly better. But all my symptoms in terms of, the IBS, the anxiety, all of that was still there.
So what's a conventional way, Tila? When you say a conventional way?
Well, this is how I would treat patients. Someone comes in with tired all the time or IBS. It's kind of like you do a set of blood tests. You look for, thyroid function, especially vitamin D levels. And, I was hoping for something, a reason to be found. My mum had hypothyroidism and I was hoping that, that will explain everything, but it didn't. And this is, I think my experience of this actually helps me explain this to patients as well. But nothing was found. And then I lost weight in a conventional way, the whole kind of calorie counting. And it led to, a lot of orthorexia in terms of, really worrying about going out and how much I was eating and stuff like that.
When you say orthorexia, what do you mean for our listeners?
In terms of, the conventional way we've been taught is, you just need to eat less and you need to move more, right? And no focus on actually what are you eating? What is the quality of it? And I just my sister-in-law is vegan, and back then, about 5 years ago, there were lots of documentaries coming on about the environment. And I was born sort of vegetarian in the household, but eating meat outside. So I always grew up with the concept of ahimsa in Hinduism. So, I felt like, what I was doing was fundamentally wrong. But, my partner at the time was an omnivore, and I felt like, how was I going to do this? But I wanted to do it at some point. And I kept flitting from being an omnivore to being vegetarian to being an omnivore. But, always thinking that eventually I do want to become vegetarian or vegan. And at that point in time when those documentaries were coming on, I devoured them in terms of the environment. And then a Veg Pledge advert came on, I think Instagram or Facebook, where the Cancer Research UK was urging people to be vegan. And I was thinking, well, Cancer UK are promoting this, so it must be good for our health. But I didn't know how to do it. But I told myself that I want to do this without having any processed sort of vegan meats. I want to do this more naturally.
Right.
So I kind of like stumbled into whole food plant-based, although I didn't really know what I was doing.
Because actually that's one of the objections a lot of people who aren't vegan have about going plant-based, is that there's a lot of these very processed foods that kind of walk around as plant-based foods, and they're like, I want to have real food. So you went from, okay, I want to be vegan, but I want to do it without the processed food bit.
Yeah, I just wanted to challenge myself that what could I do with food? I mean, I was a good cook, and I just wanted to, rely on doing things, cheaply and more whole food plant-based. But I didn't know that at the time that this was the epitome of good health. But suddenly the weight started dropping off. I wasn't really exercising that much. My NEAT was up. I was doing a lot of, housework and things like that and going for walks. But suddenly, my IBS got sorted. My migraines got better. My mood was better. And then, I carried on. And then, lockdown hit, and I started then it's kind of like, oh, well, what's the point? And I had a few more processed foods then. I did gain a bit of weight, but nowhere back to where I was before. And my mum then got a diagnosis of a precancerous lesion in her lung. And she was told by her not oncology team, but the respiratory nurses, that just eat whatever you like, eat a lot of food, you need the energy. So she gained a lot of weight, and she knew what I was doing and just thought I was a bit crazy. She'll deny that, but at the time she was like, what are you doing? I think you're mad. I think, they have this saying in Gujarati, kok kok war, like sometimes you can have dairy or sometimes you can have this, right? So, but then she came to live with me because we had just had COVID, and I was a bit of a nutcase in terms of COVID at that time because I'd already lost one parent, and, thinking that, there's a pandemic around, I don't want anything to happen to her. She came to live with me, and she was actually seeing the way I was eating, and she thought, actually, this is not hard. It's not, it's not rocket science. Let me do this as well. And she lost a lot of weight. She regained her health. And I came across a video of Anne Esselstyn. So Dr. Caldwell Esselstyn is like the godfather of lifestyle medicine as well, whole food plant-based nutrition, all those years ago, and him, helping people with heart disease actually reverse their symptoms.
I've personally spoken with him, actually. He's a really genuinely nice human being. He's a really good guy.
Okay. Amazing. I mean, they're a powerhouse, that family. So I was watching her and her mum cook onions without oil, and I was just like, really? Is this possible? And then suddenly, all those videos kept going, and I was looking at all the books and started reading them. And then, my life changed. So I'm really, really grateful to the Esselstyns and all the lifestyle medicine doctors.
Great. So, you've had your second child, you're not feeling great. You've got a number of conditions, including IBS and migraines. You've had a number of tests hoping that something will show so that you can deal with it. Yeah. Nothing shows, so there's nothing to functionally deal with, but the problems are still there. And then you begin on this diet journey. And suddenly everything starts to get better. Your mother gets involved. She gets better. And then is this a point where you start to train for to become a lifestyle doctor?
Yeah, so I kind of had all the information from my own research, but I think doing the British Society of Lifestyle Medicine, the diploma, actually just, gave me that confidence that, look, this is a qualification. I am trained to give this advice, but I was helping patients way before that, when I had my own journey. I think at the beginning, I think my focus was, when you learn all this stuff and it's kind of like this light bulb moment, you kind of want patients to do everything, 100%. And actually, I'm learning with time that, fear is not a good motivator, as Dr. Dean Hornish says. Getting people in slowly and saying that not everybody's at the right time in their lives to make a complete change, and they may not have the right circumstances, but just having a few positive changes that they can sustain, and seeing how they feel. The positive changes are a better motivating factor than, fear. Someone will have a heart attack and they'll stop by McDonald's for maybe 2 weeks and then go back into old patterns.
Okay.
So I'm just finding, live by example. And you'd be amazed at how many people you touch or sow a seed in terms of their health. So, it's just a different way of practicing medicine, which I really, really enjoy now, and I'm less jaded by.
Okay, good. And so you're working as a GP, and you also have a specialist interest in chronic fatigue syndrome at the Royal London Hospital of Integrated Medicine, in addition to the work that you're doing via the Plant Promoting Doctor website. So tell us a little bit, how is fatigue positively impacted by lifestyle change? And how would fatigue typically be treated by your standard NHS GP?
So I kind of alluded to it in terms of the way I was treated, and the way I used to treat patients is that often, you'd get patients come in saying they're tired all the time. We called it TAT as an abbreviation in general practice and in medicine. And, you do the barrage of tests, you do the vitamin D, the B12, the folate, and you'll do the thyroid function, and then you won't find anything. And my heart used to sink. It used to be like, oh God, I've done the test. Now what am I going to say? Take vitamin D. Oh, but doctor, I'm already taking vitamin D. And that'd be the crux of it. I'm sorry if other doctors are, knew more than that, but generally speaking, that's all we know, really. Or you'd mention the mood and put someone on an antidepressant. And actually, I stumbled across the chronic fatigue job by chance, because I was working at a prevention of admission job where we treat elderly patients at home to prevent them going into hospital. And our manager had just come around saying, would anyone like this job? And I turned around and said, no, I don't want it, because, my heart would sink, as soon as someone hears chronic fatigue syndrome, they just think, oh, well, that's a patient with unexplained symptoms we don't know what to do with. So I initially said no. And a colleague said to me, Tila, have you realized you're interested in lifestyle medicine? Do you not realize how this ties in? And I thought, actually, I didn't think about that. And that's how I stumbled into the job. And I apologize to my patients and everybody out there, because that often as doctors, we kind of write off patients that, that they don't want to know about lifestyle. Someone may be lazy, they're just eating too much and not exercising enough. Actually, a lot of our patients just want to be heard and have a conversation, and they are motivated to change. But unfortunately, the way the medical system is at the moment, it's completely upside down. We're constrained by resources. A 10-minute appointment, you cannot, you can't make significant change in that. So, there needs to be change and momentum to focus on prevention, to focus on, just ask a simple question. What did you eat last night? What time did you go to bed? So, it's really important. And lifestyle medicine is in its infancy in the UK compared to places like America. But we have we have a organization called Plant-Based Health Professionals UK, headed by Dr. Shireen Kazam, which is an amazing resource. She's pulled all these health professionals together and the community together to focus on lifestyle medicine, particularly plant-based nutrition. And I think more and more, younger doctors, younger GPs, and even established GPs are looking into lifestyle medicine. So I think things will change. I am positive about the future, but it's quite slow at the moment.
I'd hope they change, and I hope it changes rapidly, because there's so much. I mean, the Dean Ornish studies that you referred to earlier on took place back in the mid 90s, right? He showed reversal of cardiovascular disease. And we're using the term here, reversal, back in the mid 90s, and those studies have been repeated and been shown to be true since then. Again, so we're almost 30 years on. Things haven't really changed that dramatically. Let's hope things change quickly, and I do think the plant-based professionals website that you're referring to, I've seen that, and that gave me a lot of hope as a kind of an outside observer. Okay, so I mean, what kind of changes would you see, or can you give me an example of someone whose health has profoundly benefited from lifestyle medicine that wouldn't have been possible under traditional approaches?
So I'll give you an example of someone in general practice. So I saw a gentleman who's Eastern European in origin, in his mid-40s, who I was just looking at blood test results, and he had a raised sugar level. So we call it HbA1c, which shows your sugar levels over 3 months. And traditionally, if you're looking at results, often GPs, including myself, may send a text message saying that this level is raised, let's repeat it again, right? And put them into diabetic clinic without a conversation. But actually, at that time, I'd made changes in my health and knew about lifestyle medicine. So I called him in for an appointment, and we discussed his lifestyle. And he said, where I'm from, we live through poverty. So my mum didn't want us to, be raised like that. So she fed us lots of, rich foods because it's a sign of we're doing well now. Right. But actually, she's a nurse and is very interested in lifestyle medicine, trying to treat things without medication. And he said, I'm really motivated. Tell me what to do. So this is someone who said that he was having cream and butter inside for every meal. Wow. Go more plant-based, and within a month he lost 3 kilograms in weight, and his HbA1c improved quite significantly. And we have a way of working in terms of if you have a newly diagnosed diabetic. So just to interrupt there, sorry. So, did this person completely change their diet to a plant-based diet, or? Yeah. Right. Yeah. So they completely went to a plant-based diet. Okay, great. He completely went to a plant-based diet. He said, I don't do stuff in halves. So if you tell me to do something, I will do it. Right. So he completely went plant-based. And, he wasn't using completely whole foods. He was using some processed foods as well. But obviously he had a lot of weight to lose. So, the changes he saw were quite dramatic. And we have to follow a protocol, right? Which is safe in terms of we have to refer a patient into the diabetic clinic. We have to do certain tests as well, and referrals to a diabetic education program. And the way the NHS works at the moment is that we focus on carb counting, which is kind of focusing on the symptom as opposed to the cause.
We've spoken so much on this subject on this show, on the Together We Can program at Fever Radio, we've tried to reinforce that idea that raised sugar levels is a symptom of diabetes, not the cause of diabetes. Would you say that that's true?
Yes, I mean, I'm not saying that everybody should be consuming sugar. I certainly don't. But, not all carbohydrates are created equal. We need complex carbohydrates. Our brain needs it as a fuel. So does our muscle. And actually, unfortunately, in some parts of the UK, low carbohydrate diets, especially, focusing more on the, keto type diets have been approved, even though there's not much evidence and actually evidence of it being harmful. And we're actually not looking at the root cause, which is the fact that, insulin resistance is contributed by the fact that there's saturated fat in our cells, which is preventing, glucose, which is our main fuel, from entering our cells and providing us fuel. So, and often I find this in the Asian community, particularly. I'm South Asian, and a lot of the blame is our diet. It's very carb heavy, and that's why, we have all these problems. But actually, if you look centuries ago, when we're being more whole food, plant-based, these conditions weren't much of a problem. So I think we're focusing very wrongly on the on aspects of health that are actually good for us. We know now, there was a large study in Nature, 184 countries, which showed that the more whole grains, the more whole plant foods, including fruits, vegetables, and legumes that you include in your diet, the better the outcomes. I mean, you've got 184 countries where they're proving the same thing. So when are we going to actually wake up and see that? Anyway, with this patient, he did well, but unfortunately, my colleague who saw him in diabetic clinic had focused on the fact that we need 2 blood tests to say whether a patient definitely has diabetes. But, what are we going to wait 2 months to see that the level is the same, or are we going to motivate that patient to actually change and do better? So things are heading that way, but quite slowly.
Okay.
And unfortunately, there's lots of misinformation out there.
There is, and that's one of the big issues. I mean, how can there's so much confusion for the regular person who's just having a little interest in nutrition today. If they would start reading about it, on one side you've got ketogenic diets, on the other side you've got low-fat diets, on one side you've got carnivore diets, on the other side you've got vegan diets. It's like, which one is the truth? And, in the confusion, people just end up saying, I won't do anything, kind of thing. But yeah, it's true. We've seen here, we have 2 people who are very close to Fever Radio in recent times who are diabetic and have been able to treat it phenomenally well. And in a very, very short period of time, I mean, within days and weeks, they've seen their blood sugar numbers drop. In one case, their HbA1cs completely normalize within 3 months.
It's amazing.
It's just remarkable. I mean, these are results that aren't attainable with drugs today, and then the side effects of this dietary change is a drop in cholesterol, a drop in blood pressure, basically just general health improves in the body. So it's great to hear that you're seeing similar things in with your patients, and that hopefully we're hoping that it goes from strength to strength. Tila, how do people find you if they're interested in finding out more about the kind of stuff you do and the way that you're treating patients?
Yes, so I work privately as a health coach, as well as on the NHS as a chronic fatigue syndrome and fibromyalgia doctor. But I have a website, so www.plantpromotingdoctor.com, and I have an Instagram handle as well, plant_promoting_doctor. And that's exactly what I do. So what I'm going to say is, look, whole food plant-based nutrition is not a panacea. It's not going to cure everything, but it's about stacking our cards right. And we're not saying that it's either medication or it's lifestyle. But, apart from antibiotics, medications aren't a cure. They are a helpful stopgap in terms of if your brake pads were not working in your car, you've got the handbrake there as an emergency. But we need to actually fix the actual foot brake. So that's exactly what we're doing with medication. So lifestyle is really, really important. It's 70 to 90% of disease in terms of, genetics only explains about 10%. Just because your dad had a heart attack doesn't mean you'll have one. So really, really important. And we're not going to make the whole world vegan. And actually, when I speak to my patients, they're not actually eating food. They're eating a lot of ultra-processed foods that are high in calorie density. So it's about encouraging the healthy foods, going predominantly that way. So we want to be inclusive to everybody.
Yeah, I mean, it's remarkable what the body can do when you take the wrong foods away and you put the right foods in.
Yeah.
But like you say, it's not a panacea, is it? And there is a space for drugs in certain cases. But as we've also heard from other doctors, 80 to 90% of disease it seems to be attributable to lifestyle. And so then the solution does somewhat depend upon changing those lifestyle habits that cause the problem in the first place, isn't it?
Yeah, totally agree with that. Totally agree with that. Unfortunately, we live in an imperfect world, so we're not blaming people that, this is your fault. Food is there, I wouldn't call it food, but the stuff is there to entice you, and it's not about willpower. We need to change the way we look at things and we look at health.
Great. Dr. Tila Kansagra, thank you so much for coming to talk to us at Fever Radio today. I hope we might be able to have a chance to meet again and discuss some of the other aspects of lifestyle, because there's more than just nutrition, isn't there, that builds into good health. So once again, thank you so much for taking the time to join us today. It's been an absolute pleasure.
You're welcome. Thank you.
Thank you.